Narrative feels responsible in healthcare documentation. It feels careful. It feels professional. It feels like you're showing clinical judgment. In environments where notes are read individually, narrative often passes without issue. However, once notes are under audit scrutiny, documentation is no longer evaluated as communication. Rather, it is evaluated as evidence. That shift leads to a rule that governs everything that follows. Document so the note is defensible without explanation. This rule matters because audit review does not include conversation. There is no opportunity to clarify intent. There is no opportunity to explain reasoning verbally, and there's no opportunity to add context later. The note must hold its position exactly as written. Many clinicians continue to write as if the reader will understand what is implied, as if clinical experience fills in the gaps, as if shared knowledge carries forward, or as if explanation will be credited. Audit review does not operate on shared understanding. Notes are read comparatively. Language is isolated. Patterns are evaluated across cases. Under that kind of review, narrative becomes unstable. So the purpose of documentation changes. It is no longer to sound reasonable. It is to remain defensible when separated from the clinician who wrote it. Consider a note that states that the care plan was appropriate given the patient's condition. In day-to-day clinical work, that sounds sufficient. It signals judgment, experience, and confidence. On the other hand, under audit scrutiny, the sentence creates dependency on explanation. Appropriate according to what criteria? Which aspects of the condition mattered? How the decision would be justified without additional context? The note relies on shared clinical understanding to function. That reliance is exactly what audit systems remove. A defensible note does not describe confidence. It makes the decision logic legible on the page. The same issue appears frequently in documentation tied to utilization review or billing scrutiny. A narrative-driven note might say that based on the patient's overall presentation, continued inpatient care was warranted. To the writer, that feels cautious and thorough. To an audit reader, it raises immediate questions. Questions like, what elements of the presentation supported inpatient status? Or what alternatives were considered? Where does the justification exist without inference? The phrase overall presentation depends on interpretation. Interpretation is not defensible. A defensible note does not reassure. It states the decision and the rationale in a way that stands alone. Not longer everywhere, not more detailed universally. Explicit where the decision occurs. When you document so the note is defensible without explanation, your behavior shifts. You stop writing to sound careful. You start writing to be durable. When this happens, you stop relying on narrative flow. Rather, you prioritize explicit reasoning at decision points. You stop assuming the reader shares your clinical frame. And as a result, you write so the note can survive being compared to others without clarification. This is truly not about adding volume. It is about removing dependence on interpretation. Once notes are under audit scrutiny, narrative becomes unstable. Not because narrative is careless, rather because it requires explanation to function. An explanation is exactly what audit review removes. So, the rule holds. Document so the note is defensible without explanation. If the note needs you to present anything to make sense of it, it is already exposed. Narrative mirrors how clinicians think and speak. Audit systems do not evaluate thinking. They evaluate documentation as evidence. The shift required here is not about writing better narratives. On the other hand, it is about writing notes that survive scrutiny on their own. That is the difference between documentation that feels complete and documentation that actually holds.